WIN55.212-2 drug protects the brain and reverses cognitive damage caused by dementia. Date: January 20, 2025. Summary: WIN55.212-2, a synthetic cannabinoid agonist, has shown promise in protecting against cognitive impairments associated with Alzheimer's disease (AD). Recent studies indicate that WIN55.212-2 effectively mitigates cognitive deficits induced by aluminum chloride AlCl3 and d-galactose d-gal in animal models. This report summarizes the mechanisms of action, biochemical effects, and potential therapeutic implications of WIN55.212-2 in reversing cognitive damage caused by dementia. 1. Background of the research. Alzheimer's disease (AD) is a prevalent neurodegenerative disorder primarily affecting the elderly, characterized by significant memory and cognitive function decline. Environmental factors including exposure to neurotoxic agents like aluminum have been implicated in the pathogenesis of AD. AlCl3 is known to induce cognitive dysfunction, while d-gal is used to mimic age-related changes in lab models. Previous research has demonstrated that prolonged exposure to these substances leads to neuronal loss and cognitive impairments. 2. Mechanisms of WIN55.212-2 action. WIN55.212-2 acts as a potent agonist for cannabinoid receptors, particularly CB1 and CB2, facilitating neuroprotective effects. It promotes neurogenesis and reverses oxidative stress, both crucial factors in cognitive function. Animal studies involving Wistar rats treated with d-gal and AlCl3 followed by WIN55.212-2 administration revealed significant cognitive improvements as measured by the Morris-Watermaze MWM test, indicating enhanced spatial learning and memory. 3. Biochemical analysis. Biochemical evaluation showed that WIN55.212-2 treatment led to reduction in malondialdehyde MDA levels. MDA is a marker of oxidative stress. WIN55.212-2 significantly decreased MDA levels in treated rats, indicating its antioxidant properties. Increased superoxide dismutase SOD and glutathione GSH levels. Both SOD and GSH are critical for counteracting oxidative stress. Enhanced levels of these antioxidants were noted in WIN55.212-2 treated groups. Elevation of neurogenesis markers. The expression of nestin and glial fibrillary acidic protein GFAP was significantly increased, indicating that WIN55.212-2 promotes the regeneration of neuronal cells. 4. Histological changes. Histological examinations revealed that the hippocampal CA1 region of rats treated with WIN55.212-2 maintained a healthier neuronal morphology compared to the model group, which exhibited considerable neuronal loss and degeneration. The treatment group showed a reduction in pycnotic cells and preserved pyramidal cell layer architecture, suggesting a protective effect against neurodegeneration. 5. Comparative analysis from different sources. Various studies corroborate the effectiveness of WIN55.212-2 in enhancing cognitive function. While some research emphasizes biochemical assessments, others focus on behavioral outcomes. Differences in dosage and administration protocols have been noted, but the overarching conclusion remains consistent. WIN55.212-2 mitigates cognitive decline across several experimental setups. 6. Conclusion and future research directions. WIN55.212-2 demonstrates significant potential in reversing cognitive damage associated with Alzheimer's disease through its antioxidant effects and promotion of neurogenesis. Future investigations should explore the drug's efficacy across diverse models and delve deeper into its underlying mechanisms. This research could pave the way for innovative treatment strategies for Alzheimer's disease and other neurodegenerative disorders. References. 1. Matteo, et al. 2021. WIN55.212-2 attenuates cognitive impairments in AlCl3 plus d-galactose-induced Alzheimer's disease rats by enhancing neurogenesis and reversing oxidative stress.
Biomedicines. 2. News-medical.net. Study uncovers mechanism for cognitive improvement in dementia. 2025. 3. ScienceDaily.com. Research reveals potential of synthetic cannabinoid in treating dementia. 2025.
This report encapsulates the findings related to WIN55.212-2 as a promising therapeutic agent against cognitive decline in dementia, presenting a comprehensive overview of its effects and potential clinical applications. Further exploration in this area could lead to groundbreaking advancements in dementia treatment. The investigation regarding the drug WIN55.212-2 reveals several counterintuitive findings that challenge conventional beliefs about cognitive dysfunction, neurodegeneration, and their treatment. Here are some key counterintuitive points derived from the study. 1. Cannabinoids as neuroprotectants. It is commonly perceived that cannabinoids primarily have psychoactive effects and are associated with cognitive impairment. However, WIN55.212-2, a synthetic cannabinoid, demonstrates neuroprotective properties that not only protect against cognitive decline but also actively reverse cognitive impairments caused by neurotoxic agents like aluminium chloride and d-galactose. 2. Oxidative stress and cognitive decline. The conventional narrative holds that oxidative stress is detrimental and leads to neurodegeneration. While this is true, the study suggests that the modulation of oxidative stress via WIN55.212-2 treatment can beneficially alter the oxidative state in the brain. Specifically, WIN55.212-2 reduces malondialdehyde MDA levels, a marker of oxidative damage, and increases antioxidant levels like superoxide dismutase and glutathione, counteracting the expected detrimental effects of oxidative stress. 3. Neurogenesis in aging. A common assumption is that neurogenesis, or the generation of new neurons, declines irreversibly with aging in neurodegenerative diseases. Contrary to this belief, the study shows that WIN55.212-2 administration can enhance neurogenesis markers nestin and GFAP in aged rat models, suggesting that neurogenesis can be stimulated even in conditions typically associated with cognitive decline. 4. Comparison with traditional treatments. Traditional treatments for Alzheimer's disease, such as cholinesterase inhibitors e.g. donepezil, primarily focus on symptom management rather than reversing cognitive impairment. WIN55.212-2 shows not only comparable effectiveness in improving cognitive function but also suggests a potential for recovery of neuronal function and structure, which is not characteristic of conventional treatments. 5. Dual role of neurotoxins. While aluminium chloride and d-galactose are known neurotoxins that induce cognitive dysfunction, the study presents an argument that their effects can be modulated through pharmacological interventions like WIN55.212-2, which could lead to a reconsideration of how these substances are viewed in terms of neurodegenerative modeling. Instead of being solely harmful agents, they may serve as tools to understand and test potential neuroprotective strategies. 6. Behavioral outcomes versus biological mechanisms. The study emphasizes that behavioral improvements in cognitive tasks like the Morris-Water maze correlate with biochemical and histological changes rather than being purely behavioral phenomena. This interconnection suggests that cognitive assessments should be framed within the context of underlying biological mechanisms, which may not be a widely recognized approach. 7. Potential for reversal of cognitive damage. The prevailing belief is that cognitive damage from neurodegenerative conditions is often irreversible. However, the results from using WIN55.212-2 indicate that it may be possible to not just halt but potentially reverse the cognitive impairments typically associated with such conditions, opening new avenues for therapeutic interventions. These counterintuitive insights underscore the complexity of neurodegenerative disorders and the potential for pharmacological strategies that diverge from traditional therapeutic models. The findings advocate for a re-evaluation of cannabinoids in neuroprotection and cognitive health, suggesting a paradigm shift in how we approach treatment methodologies for conditions like Alzheimer's disease. The report on WIN55.212-2 presents several important findings regarding its neuroprotective and cognitive enhancing effects in a rat model of Alzheimer's disease AD. While many aspects of the research have been highlighted, there are several significant details that may be overlooked by readers, which warrant further discussion due to their implications for understanding and potentially treating dementia. 1. Mechanisms of action, oxidative stress and neurogenesis. One of the most critical aspects of this research is the emphasis on the dual mechanisms by which WIN55.212-2 exerts its effects, reducing oxidative stress and promoting neurogenesis. The study demonstrates that WIN55.212-2 significantly reduces malondialdehyde MDA levels, a marker of oxidative damage, while increasing levels of superoxide dismutase SOD and glutathione GSH, both of which are crucial antioxidants. This is particularly significant because oxidative stress is a well-established contributor to the pathogenesis of AD. The failure to highlight the specific biochemical pathways involved in oxidative stress may lead to an underappreciation of WIN55.212-2's potential mechanisms. For instance, the reduction of MDA levels indicates a direct protective effect on neuronal integrity, which could be crucial for therapeutic strategies aimed at mitigating neurodegenerative processes. Moreover, the enhancement of neurogenesis markers nestin and GFAP suggests that WIN55.212-2 may stimulate the brain's inherent capacity for repair and regeneration, which is often compromised in neurodegenerative diseases. 2. Histological evidence of neuroprotection. The report includes histological evaluations that reveal the preservation of neuronal structure in the hippocampus of rats treated with WIN55.212-2 compared to those in the model group that exhibited significant neuronal loss and disorganization. Histological analysis using Nissl staining is a powerful tool that can provide insights into the neuroprotective effects of a treatment. This finding underscores the importance of assessing not only behavioral outcomes but also structural changes in the brain, which may be more indicative of the long-term effects of a treatment on cognitive function. The fact that WIN55.212-2 treated rats showed a higher number of viable neurons compared to untreated models suggests that this compound could play a crucial role in preserving cognitive functions by maintaining the structural integrity of relevant brain regions. Ignoring these histological results could lead to an inaccurate assessment of WIN55.212-2's overall efficacy. 3. Behavioral outcomes in the Morris-Water maze. The use of the Morris-Water maze MWM as a behavioral assessment tool is well justified, yet the nuances of the results may be overlooked. The study reports significant differences in escape latency and distance in the MWM between treatment groups. Readers may focus primarily on the overall improvement in cognitive functions, but the specific patterns observed in the swimming behavior of treated rats, such as purposeful navigation compared to the erratic swimming patterns of the model group, provide deeper insights into cognitive processing capabilities. Moreover, the detailed statistical analyses conducted ANOVA and post-hoc tests lend credibility to the findings. The statistical significance not only indicates that the effects of WIN55.212-2 are robust but also suggests that various dosages can lead to different levels of efficacy, which may inform future dosing strategies in clinical applications. 4. Comparative analysis with existing treatments. Another critical aspect that may be overlooked is the comparative analysis of WIN55.212-2 with donepezil, a standard treatment for AD. While the study focuses on the effectiveness of WIN55.212-2, it also provides insights into how it compares with current pharmacological approaches. The results indicating that WIN55.212-2 may offer similar or even superior cognitive benefits while potentially having a different side effect profile could revolutionize treatment paradigms for AD. This comparative perspective is significant because it highlights the potential for WIN55.212-2 to not only serve as an adjunct therapy but possibly as an alternative to existing treatments, which often come with significant side effects. The implications for patient care could be substantial, especially considering the growing need for more effective and safer therapeutic options in dementia treatment.
5. Potential implications for future research.
The findings regarding WIN55.212-2's effects on neurogenesis and oxidative stress open new avenues for research.
There is a need for further exploration into the long-term effects of this compound, including its safety profile and efficacy in human subjects. The report mentions the necessity for additional studies to understand the therapeutic mechanisms involved, which is crucial for translating these findings into clinical practice. Additionally, the discussion surrounding the role of nestin and GFAP as markers for neurogenesis merits further investigation. Future studies could explore the signaling pathways involved in these processes, potentially leading to the identification of new therapeutic targets for AD and other neurodegenerative diseases. Conclusion.
In summary, while the report emphasizes the positive effects of WIN55.212-2 on cognitive function in a rat model of Alzheimer's disease, several critical aspects may be understated or overlooked. The mechanisms of action, histological evidence of neuroprotection, behavioral nuances in cognitive assessments, comparative effectiveness with existing treatments, and implications for future research all contribute to a more comprehensive understanding of WIN55.212-2's potential as a therapeutic agent. Recognizing these elements is vital for advancing our approach to treating dementia and enhancing the quality of life for affected individuals. The research surrounding WIN55.212-2 and its protective effects against cognitive damage associated with dementia provides several valuable points for in-depth analysis and discussion. Here are the 4 most significant points. 1. Mechanisms of action in cognitive improvement. WIN55.212-2 functions primarily through 2 mechanisms: enhancing neurogenesis and mitigating oxidative stress. The compound has shown the ability to reverse cognitive impairment induced by neurotoxic agents such as aluminum chloride AlCl3 and d-galactose d-gal. In animal studies, significant improvements were observed in spatial learning and memory when assessed through the Morris-Watermaze MWM test. The drug's effectiveness in reducing oxidative stress is evidenced by the decreased levels of malondialdehyde MDA, a marker of oxidative damage, and the increased activities of superoxide dismutase SOD and glutathione GSH. This oxidative stress reduction is critical because it is a known contributor to neurodegenerative diseases like Alzheimer's. Understanding these mechanisms provides insights into potential therapeutic strategies for dementia. 2. Neuroprotective effects on neuronal integrity. Histological analyses revealed that WIN55.212-2 treatment resulted in preserved neuronal morphology in the hippocampus, specifically in the CA1 region, which is crucial for memory and learning. The compound was associated with decreased neuronal apoptosis and maintained the structural integrity of pyramidal cells when compared to control groups exposed to neurotoxic substances. This neuroprotective effect emphasizes the importance of WIN55.212-2 and potentially preventing or reversing the neurodegeneration characteristic of dementia. The preservation of neuronal structure is vital for maintaining cognitive function, and this finding underscores the compound's potential as a neurotherapeutic agent. 3. Role of neurogenesis markers. The study's analysis of neurogenesis markers such as nestin and glial fibrillary acidic protein GFAP provides compelling evidence of WIN55.212-2's role in promoting neurogenesis. Increased expression of these markers indicates enhanced neurogenesis, which is often impaired in models of dementia. The elevation of GFAP levels in particular suggests that WIN55.212-2 not only supports neuronal survival but may also contribute to the regeneration of neural tissues. Exploring the implications of neurogenesis in cognitive recovery could lead to novel approaches in treating neurodegenerative diseases. 4. Comparative efficacy and future research directions. The findings regarding WIN55.212-2's efficacy in reversing cognitive deficits are notable, especially when compared to existing AD treatments like donepezil.
while donepezil primarily functions as a cholinesterase inhibitor. WIN55.212-2 appears to offer multifaceted benefits by addressing oxidative stress and promoting neurogenesis. This comparative perspective highlights the potential for developing cannabinoid-based therapies as viable alternatives or adjuncts to current treatment regimens. Future research should focus on clinical trials to establish the therapeutic potential of WIN55.212-2 in human populations, determine optimal dosing strategies, and elucidate the precise molecular pathways involved in its neuroprotective and cognitive enhancing effects. In summary, the exploration of WIN55.212-2's mechanisms of action, neuroprotective effects, role in neurogenesis, and comparative efficacy against existing treatments provides a rich foundation for further discussion and investigation into potential treatments for dementia-related cognitive impairments. 1. The case of the bromide insanity in the 19th century. During the late 1800s, bromide was widely used as a sedative and anticonvulsant. However, excessive use led to a condition called bromism, which resulted in cognitive impairments, memory loss, and changes in behavior resembling dementia. Medical professionals began to recognize the neurotoxic effects of bromide, leading to a re-evaluation of its use in medicine. This case highlights the importance of understanding drug effects on cognitive function and the need for careful monitoring of dosages in therapeutics. 2. Thalidomide and its neurodevelopmental impacts. Thalidomide was initially introduced in the late 1950s as a sedative and treatment for morning sickness in pregnant women. It was later linked to severe birth defects, including phocomelia and neurodevelopmental issues in children. The fallout from thalidomide's use led to stricter regulations on drug approvals and monitoring of drug effects on cognitive and developmental health. This historical case underscores the significance of understanding the long-term neurodevelopmental impacts of substances on health. 3. The Tuskegee syphilis study and its ethical implications. Conducted between 1932 and 1972. This infamous study observed the natural progression of untreated syphilis in African American men without their informed consent. The study highlighted severe ethical violations and the neglect of cognitive and physical health impacts on participants. The fallout from this study led to the establishment of ethical guidelines and regulations regarding human subjects in research. This case serves as a powerful reminder of the ethical responsibilities researchers have toward participants, particularly concerning treatments that affect cognitive function. Future outlook on WIN55.212-2 and its potential in dementia treatment. The increasing prevalence of Alzheimer's disease (AD) and other forms of dementia necessitates innovative therapeutic approaches. WIN55.212-2, a synthetic cannabinoid agonist, has shown promise in preclinical studies for its neuroprotective effects and ability to reverse cognitive deficits associated with dementia. As research continues, several key areas for future exploration and potential developments emerge. 1. Mechanistic understanding and target identification. Future studies will focus on elucidating the precise mechanisms behind WIN55.212-2's neuroprotective effects. Understanding how this compound interacts with the endocannabinoid system, specifically its affinity for CB1 and CB2 receptors, will be crucial. Identifying downstream signaling pathways and neuroprotective mechanisms will help in refining its application and could lead to the development of more targeted therapies. 2. Clinical trials in human studies. As preclinical results demonstrate efficacy in animal models, translating these findings into human clinical trials is essential. Future research should prioritize Phase 1 trials, assessing safety, tolerability, and pharmacokinetics of WIN55.212-2 in healthy volunteers. Phase 2 trials, evaluating efficacy in patients diagnosed with early-stage Alzheimer's or mild cognitive impairment. Longitudinal studies, investigating long-term effects and potential side effects of WIN55.212-2 treatment over extended periods in diverse patient populations. 3. Combination therapies.
Given the multifactorial nature of AD, exploring WIN55.212-2 in combination with existing treatments such as cholinesterase inhibitors or NMDA receptor antagonists could enhance therapeutic outcomes.
Future research should focus on
synergistic effects, investigating whether combining WIN55.212-2 with these treatments leads to improved cognitive outcomes compared to monotherapy. Personalized medicine, tailoring combinations based on individual patient profiles including genetic and biomarker analyses. 4. Exploration of other cannabinoids. While WIN55.212-2 shows promise, the wider cannabinoid repertoire offers potential alternative treatments.
Future research should investigate
different cannabinoid profiles, assessing the effects of other cannabinoids such as cannabidiol CBD in conjunction with WIN55.212-2 to evaluate synergistic benefits.
Cannabinoid derivatives, developing new compounds with enhanced efficacy or reduced side effects based on the structure-activity relationship of cannabinoids. 5. Understanding patient variability.
Research should also focus on understanding how different patient factors may influence the efficacy of WIN55.212-2, including age, gender, genetic predispositions, and comorbidities.
This understanding could lead to
biomarker development, identifying biomarkers that predict responsiveness to WIN55.212-2 treatment. Stratified approaches, developing stratified treatment protocols based on patient characteristics to optimize therapeutic outcomes. 6. Neuroprotective mechanisms beyond cognitive improvement. Future studies should also explore the broader neuroprotective effects of WIN55.212-2 beyond cognitive improvement,
including
neuroinflammation, investigating how WIN55.212-2 modulates neuroinflammatory responses and whether this contributes to its protective effects against Alzheimer's pathology. Oxidative stress, further exploring the compound's antioxidant properties, assessing its impact on oxidative stress markers and understanding its role in neuronal survival.
7. Regulatory and ethical considerations.
As research progresses, regulatory and ethical considerations surrounding cannabinoid use in medicine will become increasingly important.
Future discussions should focus on regulatory pathways, navigating the complex landscape of regulatory approval for cannabinoid-based therapies.
Ethical implications, addressing ethical concerns related to the use of cannabinoids, particularly in vulnerable populations such as the elderly.
8. Public awareness and education.
Increasing public awareness of the potential benefits and risks of cannabinoid treatments is crucial. Educational initiatives should aim to inform healthcare providers and patients about emerging research findings to facilitate informed decision-making regarding treatment options.
Conclusion.
In conclusion, WIN55.212-2 presents a promising avenue for dementia treatment,
with significant potential to protect against cognitive decline and promote neurogenesis. As research advances, thorough exploration of its mechanisms, clinical applicability, and integration into broader therapeutic strategies will be essential.
This multifaceted approach may pave the way for innovative treatments that could significantly improve the quality of life for individuals affected by Alzheimer's disease and other forms of dementia.